Question 1. A 36-week pregnant woman presents with severe abdominal pain, vaginal bleeding, and uterine tenderness. What is the most likely diagnosis? A. Placenta previa. B. Placental abruption. C. Preterm labor. D. Ectopic pregnancy. Answer: B. Placental abruption. Rationale: placental abruption is characterized by premature detachment of the placenta, leading to abdominal pain, bleeding, and uterine tenderness. This is a critical situation requiring immediate intervention to prevent fetal and maternal complications. Question 2. A pregnant woman at 32 weeks gestation presents with persistent hypertension, proteinuria, and edema. Which of the following interventions should the midwife prioritize? A. Administer antihypertensive medication. B. Perform a cesarean section immediately. C. Monitor for signs of preeclampsia progression and prepare for possible emergency delivery. D. Recommend bed rest and hydration. Answer: C. Monitor for signs of preeclampsia progression and prepare for possible emergency delivery. Rationale: the patient exhibits signs of preeclampsia, a condition that requires careful monitoring for signs of worsening, such as seizures or liver failure. Immediate intervention may be required, including delivery, depending on the severity. Question 3. In managing a breech presentation at term, which of the following is the most appropriate action? A. Perform a manual rotation to attempt to turn the baby. B. Schedule a cesarean section for delivery. C. Attempt vaginal delivery with support. D. Perform a trial of forceps-assisted delivery. Answer: B. Schedule a cesarean section for delivery. Rationale: breech presentations at term carry significant risks, including cord prolapse and head entrapment. A cesarean section is generally the safest method of delivery for breech presentations at term. Question 4. A woman in labor is experiencing signs of fetal distress with late decelerations on the fetal heart rate monitoring. What is the next immediate action? A. Increase maternal IV fluids to improve perfusion. B. Perform an urgent cesarean section. C. Position the mother in a left lateral position and administer oxygen. D. Increase the Pitocin infusion to strengthen contractions. Answer: C. Position the mother in a left lateral position and administer oxygen. Rationale: late decelerations indicate uteroplacental insufficiency, and the first response is to optimize maternal oxygenation and uterine perfusion by repositioning the mother and administering oxygen. A cesarean may be required if the situation does not improve. Question 5. A midwife is caring for a postpartum woman who is showing signs of a retained placenta with continued bleeding after 30 minutes. What is the first intervention? A. Manual removal of the placenta. B. Administering a dose of oxytocin. C. Perform a bimanual uterine compression. D. Prepare for a hysterectomy. Answer: B. Administering a dose of oxytocin. Rationale: oxytocin is the first-line treatment to stimulate uterine contractions and help expel any retained placental tissue. If bleeding continues, further interventions may be needed, including manual removal. Question 6. A pregnant woman with type 1 diabetes is at 38 weeks gestation and presents with high blood glucose levels. What is the most important concern for fetal well-being? A. Risk of polyhydramnios. B. Risk of intrauterine growth restriction, IUGR. C. Risk of fetal macrosomia. D. Risk of placental insufficiency. Answer: C. Risk of fetal macrosomia. Rationale: poorly controlled diabetes during pregnancy increases the risk of fetal macrosomia, where the baby grows too large, increasing the risk of shoulder dystocia, birth injury, and cesarean delivery. Question 7. A laboring woman is found to be 6 centimeters dilated, 100% effaced, and has ruptured membranes. The fetal heart rate is 160 BPM with moderate variability. What is the next action? A. Monitor for further cervical changes and fetal heart rate patterns. B. Perform a vaginal exam to assess fetal position. C. Administer fluids and analgesics. D. Prepare for an urgent cesarean section. Answer: A. Monitor for further cervical changes and fetal heart rate patterns. Rationale: with a favorable cervix and no signs of fetal distress, the appropriate next step is to continue monitoring the progress of labor and fetal heart rate to assess the need for further interventions. Question 8. A midwife notices a 32-week gestation pregnant woman exhibiting signs of fetal movement reduction. What is the first action to take? A. Reassure the mother that reduced fetal movement is normal. B. Perform an ultrasound to assess fetal well-being. C. Monitor fetal heart rate for 30 minutes. D. Recommend immediate induction of labor. Answer: B. Perform an ultrasound to assess fetal well-being. Rationale: reduced fetal movement at 32 weeks is concerning and warrants further investigation, such as an ultrasound, to assess fetal well-being and exclude any complications. Question 9. A 28-week pregnant woman with a history of preterm labor presents with lower abdominal cramping and regular contractions. What is the most appropriate initial intervention? A. Administer magnesium sulfate to stop contractions. B. Perform a cervical check to assess dilation. C. Administer steroids for fetal lung maturity. D. Monitor contractions and fetal heart rate without intervention. Answer: A. Administer magnesium sulfate to stop contractions. Rationale: magnesium sulfate is the first-line treatment to stop preterm labor by inhibiting uterine contractions. The other interventions, e.g., steroids, cervical check, may follow depending on the situation. Question 10. A postpartum woman is experiencing dizziness, weakness, and an increased heart rate. She is found to have a hematoma in the vaginal canal. What is the next appropriate action? A. Perform a pelvic exam and monitor vital signs. B. Apply ice to the vaginal area and continue monitoring. C. Take the patient to the operating room for incision and drainage of the hematoma. D. Give oral fluids and administer pain relief. Answer: C. Take the patient to the operating room for incision and drainage of the hematoma. Rationale: a postpartum hematoma, especially if causing shock-like symptoms, requires urgent surgical intervention to prevent further blood loss and stabilize the patient. Question 11. A woman with a history of previous cesarean section presents at 40 weeks with signs of labor. What is the most important concern for delivery? A. Risk of placental abruption. B. Risk of uterine rupture. C. Risk of excessive bleeding during delivery. D. Risk of fetal distress due to uterine contractions. Answer: B. Risk of uterine rupture. Rationale: a woman with a history of cesarean delivery is at higher risk for uterine rupture, particularly during labor. This risk must be closely monitored, and a cesarean may be indicated if signs of rupture appear. Question 12. A 36-week pregnant woman presents with acute onset of shortness of breath, tachycardia, and chest pain. What is the most likely diagnosis? A. Preterm labor. B. Pulmonary embolism. C. Preeclampsia. D. Anxiety disorder. Answer: B. Pulmonary embolism. Rationale: pulmonary embolism is a life-threatening condition that presents with chest pain, shortness of breath, and tachycardia in pregnant women. Immediate diagnosis and treatment are required. Question 13. A pregnant woman at 38 weeks gestation presents with sudden severe headache, blurred vision, and epigastric pain. What should the midwife suspect? A. Eclampsia. B. Preeclampsia. C. Migraine. D. Placental abruption. Answer: B. Preeclampsia. Rationale: severe headache, blurred vision, and epigastric pain are hallmark signs of severe preeclampsia, which requires immediate medical management to prevent complications for both mother and baby. Question 14. A woman in her second trimester is found to have an abnormal ultrasound showing a short cervix. What is the next step in management? A. Initiate bed rest and hydration. B. Schedule a repeat ultrasound in 1 month. C. Discuss the possibility of cervical circlage placement. D. Schedule immediate induction of labor. Answer: C. Discuss the possibility of cervical circlage placement. Rationale: a short cervix is a risk factor for preterm labor and may require a cervical circlage to prevent premature delivery. This decision should be based on the gestational age and individual circumstances. Question 15. A postpartum woman is experiencing severe abdominal pain and has a firm, tender uterus with excessive vaginal bleeding. What should be the first action? A. Administer oxytocin to stimulate uterine contractions. B. Perform a bimanual compression to control bleeding. C. Prepare for emergency cesarean section. D. Insert a Foley catheter to monitor urine output. Answer: A. Administer oxytocin to stimulate uterine contractions. Rationale: the woman may be experiencing uterine atony, which is best treated with oxytocin to stimulate contractions and reduce bleeding. Other interventions may be required if bleeding persists. Question 16. A 40-week pregnant woman is in labor and begins showing signs of uterine hyperstimulation. What is the most appropriate action? A. Increase the Pitocin dose to strengthen contractions. B. Discontinue the Pitocin infusion and administer fluids. C. Perform a cesarean section immediately. D. Administer epidural anesthesia. Answer: B. Discontinue the Pitocin infusion and administer fluids. Rationale: uterine hyperstimulation, often caused by excessive use of Pitocin, requires the infusion to be discontinued and fluids given to reduce uterine contractions and restore balance. Question 17. A 25-week pregnant woman is diagnosed with a ruptured ectopic pregnancy. What is the most critical immediate intervention? A. Administer magnesium sulfate. B. Prepare for laparotomy to remove the ectopic pregnancy. C. Perform a cervical check to assess dilation. D. Provide fluids and prepare for an emergency cesarean section. Answer: B. Prepare for laparotomy to remove the ectopic pregnancy. Rationale: a ruptured ectopic pregnancy is a life-threatening emergency that requires immediate surgical intervention to stop internal bleeding and stabilize the patient. Question 18. A pregnant woman at 30 weeks gestation presents with sudden onset of severe abdominal pain, nausea, and vomiting. She is diagnosed with acute cholecystitis. What is the most appropriate management? A. Administer antibiotics and monitor. B. Perform immediate cholecystectomy. C. Provide IV fluids and antiemetics. D. Delay intervention until postpartum. Answer: B. Perform immediate cholecystectomy. Rationale: acute cholecystitis in pregnancy requires prompt surgical intervention to prevent complications like gallbladder rupture. Delaying treatment can result in severe consequences for both mother and baby. Question 19. A postpartum woman with a history of gestational diabetes presents with excessive thirst and urination. What should the midwife suspect? A. Diabetes insipidus. B. Insulin resistance. C. Type 1 diabetes mellitus. D. Type 2 diabetes mellitus. Answer: D. Type 2 diabetes mellitus. Rationale: a history of gestational diabetes increases the risk of developing type 2 diabetes postpartum. Symptoms like excessive thirst and urination are indicative of hyperglycemia and warrant further testing. Question 20. A 34-week pregnant woman presents with severe chest pain, tachycardia, and dyspnea. What is the most likely diagnosis? A. Pulmonary embolism. B. Pneumonia. C. Preterm labor. D. Myocardial infarction. Answer: A. Pulmonary embolism. Rationale: Pulmonary embolism is a life-threatening condition that can present with chest pain, tachycardia, and dyspnea during pregnancy. Immediate diagnosis and intervention are required to prevent maternal and fetal morbidity and mortality. Question 21. A pregnant woman presents with bright red vaginal bleeding at 28 weeks gestation. The uterus is soft and non-tender. What is the most likely diagnosis? A. Placenta previa. B. Placental abruption. C. Miscarriage. D. Preterm labor. Answer: A. Placenta previa. Rationale: placenta previa is characterized by painless vaginal bleeding, usually occurring after 20 weeks. The soft and non-tender uterus supports this diagnosis. Question 22. A 30-week pregnant woman presents with hypertension, proteinuria, and a sudden increase in weight. What is the most urgent intervention? A. Administer a diuretic. B. Perform an ultrasound for fetal well-being. C. Start antihypertensive therapy and monitor closely for eclampsia. D. Provide magnesium sulfate prophylaxis. Answer: C. Start antihypertensive therapy and monitor closely for eclampsia. Rationale: these symptoms suggest preeclampsia, and antihypertensive therapy is needed to control the blood pressure and prevent the progression to eclampsia, which can cause seizures. Question 23. A pregnant woman at 39 weeks gestation presents with a sudden onset of severe abdominal pain, vomiting, and a tender abdomen. What is the most likely cause? A. Placental abruption. B. Acute appendicitis. C. Gallbladder disease. D. Uterine rupture. Answer: D. Uterine rupture. Rationale: uterine rupture is a life-threatening condition characterized by sudden abdominal pain, tenderness, and sometimes fetal distress. Immediate surgical intervention is needed. Question 24. A postpartum woman develops a sudden headache, visual disturbances, and right upper quadrant pain. What condition should the midwife suspect? A. Eclampsia. B. Postpartum depression. C. Pulmonary embolism. D. Acute fatty liver of pregnancy. Answer: A. Eclampsia. Rationale: the symptoms of headache, visual disturbances, and upper quadrant pain are indicative of eclampsia, a serious complication of pregnancy that requires immediate intervention. Question 25. A pregnant woman at 36 weeks gestation presents with a sudden increase in blood pressure, epigastric pain, and proteinuria. What is the most critical next step? A. Induce labor immediately. B. Administer corticosteroids for fetal lung maturity. C. Start magnesium sulfate and prepare for cesarean delivery. D. Monitor and follow up in 24 hours. Answer: C. Start magnesium sulfate and prepare for cesarean delivery. Rationale: the woman is presenting with severe preeclampsia. Magnesium sulfate is used to prevent seizures, and cesarean delivery may be needed if her condition does not stabilize. Question 26. A woman in labor has been pushing for 2 hours with no progress. The fetal heart rate is variable and shows decelerations. What is the priority intervention? A. Increase Pitocin infusion to strengthen contractions. B. Perform a cesarean section immediately. C. Reposition the mother to relieve cord compression. D. Apply forceps to expedite delivery. Answer: C. Reposition the mother to relieve cord compression. Rationale: repositioning the mother can relieve cord compression, which is causing variable decelerations. If repositioning does not resolve the issue, further interventions like cesarean delivery may be necessary. Question 27. A pregnant woman at 25 weeks gestation presents with lower back pain and cramping. A fetal non-stress test shows a normal fetal heart rate pattern. What should the midwife do next? A. Administer magnesium sulfate. B. Perform a cervical exam to check for dilation. C. Advise rest and hydration. D. Start oral tocolytics. Answer: B. Perform a cervical exam to check for dilation. Rationale: the patient is experiencing symptoms that could indicate preterm labor. A cervical exam is necessary to assess for any dilation or effacement, which would confirm the diagnosis. Question 28. A woman with a history of gestational diabetes presents with a 10-pound baby at birth. What is the most important consideration during delivery? A. Shoulder dystocia prevention. B. Neonatal hypoglycemia. C. Fetal distress. D. Maternal hemorrhage. Answer: A. Shoulder dystocia prevention. Rationale: fetal macrosomia increases the risk of shoulder dystocia, a condition where the baby's shoulder gets stuck during delivery. This is the most critical concern during delivery. Question 29. A midwife is caring for a postpartum woman who presents with a persistent, palpable mass in the lower abdomen, along with fever and chills. What is the most likely diagnosis? A. Endometriosis. B. Ovarian cyst. C. Pelvic abscess. D. Uterine fibroids. Answer: C. Pelvic abscess. Rationale: a pelvic abscess is a common complication after childbirth, especially following infection or a retained placenta. It presents with fever, chills, and a palpable mass. Question 30. A woman in labor at 41 weeks gestation experiences spontaneous rupture of membranes. The amniotic fluid is meconium stained. What is the next best action? A. Prepare for an emergency cesarean section. B. Encourage the woman to continue laboring naturally. C. Perform a fetal heart rate monitoring and prepare for possible suction at birth. D. Wait for signs of fetal distress. Answer: C. Perform fetal heart rate monitoring and prepare for possible suction at birth. Rationale: meconium-stained amniotic fluid is a sign of fetal distress. Continuous fetal monitoring is essential to assess fetal well-being, and suction may be required at delivery to clear the airways. Question 31. A pregnant woman at 20 weeks gestation presents with significant lower abdominal pain and vaginal spotting. An ultrasound confirms a normal intrauterine pregnancy. What should the midwife suspect? A. Ectopic pregnancy. B. Miscarriage. C. Round ligament pain. D. Placental abruption. Answer: C. Round ligament pain. Rationale: round ligament pain is common during the second trimester and can cause sharp abdominal pain and occasional spotting. It is not a complication of pregnancy and typically resolves with rest. Question 32. A 40-week pregnant woman presents with absent fetal heart tones on auscultation. What is the next immediate action? A. Perform a vaginal exam to check for cervical dilation. B. Initiate an emergency cesarean section. C. Perform an ultrasound to assess fetal status. D. Administer oxygen and continue monitoring. Answer: C. Perform an ultrasound to assess fetal status. Rationale: absent fetal heart tones are concerning and require immediate ultrasound to assess fetal well-being and determine if further action, such as emergency delivery, is needed. Question 33. A 22-year-old prima gravida at 38 weeks gestation presents with severe itching and jaundice. What condition should the midwife suspect? A. Acute viral hepatitis. B. Cholestasis of pregnancy. C. Preeclampsia. D. Gallbladder disease. Answer: B. Cholestasis of pregnancy. Rationale: cholestasis of pregnancy is characterized by pruritus and jaundice, usually in the third trimester, and can lead to adverse outcomes for the fetus. Immediate management is required to prevent complications. Question 34. A postpartum woman has been breastfeeding, but now complains of pain, redness, and swelling in one breast. What is the most likely diagnosis? A. Breast cancer. B. Mastitis. C. Clogged milk duct. D. Galactorrhea. Answer: B. Mastitis. Rationale: mastitis is a common infection that causes pain, redness, and swelling in the breast. It is often accompanied by fever and requires prompt antibiotic treatment. Question 35. A woman in her first trimester presents with nausea, vomiting, and weight loss. Her urine test is positive for ketones. What is the likely diagnosis? A. Hyperemesis gravidarum. B. Morning sickness. C. Acute gastroenteritis. D. Peptic ulcer disease. Answer. A. Hyperemesis gravidarum. Rationale. Hyperemesis gravidarum is characterized by severe nausea, vomiting, and ketonuria, leading to dehydration and weight loss. It requires medical intervention to manage symptoms and prevent complications. Question 36. A woman at 35 weeks gestation presents with shortness of breath, a dry cough, and an elevated respiratory rate. What is the most likely diagnosis? A. Pulmonary embolism. B. Pneumonia. C. Preeclampsia. D. Heart failure. Answer. A. Pulmonary embolism. Rationale. Pulmonary embolism can present with shortness of breath, cough, and tachypnea during pregnancy, and it requires immediate evaluation and management. Question 37. A 30-year-old woman with a history of 2 previous cesarean sections presents at 39 weeks gestation. What is the most important consideration for her delivery? A. Risk of uterine rupture. B. Risk of fetal macrosomia. C. Risk of postpartum hemorrhage. D. Risk of fetal distress. Answer. A. Risk of uterine rupture. Rationale. A history of multiple cesarean sections increases the risk of uterine rupture during labor, which can be life-threatening. Close monitoring and possible cesarean delivery are necessary to reduce this risk. Question 38. A woman in labor has been on Pitocin for several hours, but contractions are becoming increasingly frequent and strong. What is the most critical action? A. Increase the Pitocin dose. B. Discontinue the Pitocin infusion and monitor fetal heart rate. C. Perform a cesarean section. D. Administer epidural anesthesia. Answer. B. Discontinue the Pitocin infusion and monitor fetal heart rate. Rationale. Overuse of Pitocin can lead to uterine hyperstimulation, which can cause fetal distress. The Pitocin should be stopped, and fetal heart rate should be closely monitored for any signs of complications. Question 39. A 30-year-old woman at 32 weeks gestation presents with significant weight gain, hypertension, and proteinuria. What condition should the midwife suspect? A. Preeclampsia. B. Gestational diabetes. C. Hyperthyroidism. D. Placental abruption. Answer. A. Preeclampsia. Rationale. These are classic signs of preeclampsia, which requires close monitoring and treatment to prevent complications for both mother and fetus. Question 40. A woman who is 34 weeks pregnant presents with sudden severe chest pain, dizziness, and shortness of breath. What is the most likely diagnosis? A. Pneumonia. B. Preterm labor. C. Pulmonary embolism. D. Myocardial infarction. Answer. C. Pulmonary embolism. Rationale. Pulmonary embolism is a life-threatening emergency in pregnancy that requires immediate intervention. Chest pain, shortness of breath, and dizziness are key symptoms of this condition.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.